As paramedics, we have a unique responsibility to provide emergency medical care to those in need. But with this responsibility comes the potential for legal repercussions if things go wrong. That's why it's important and it's crucial for us to understand the concept of negligence and how it applies to our work as paramedics. Negligence refers to a failure to take reasonable care to avoid causing injury or harm to others. In the context of paramedicine, this means that we must take appropriate steps to ensure that our actions do not cause harm to our patients. If we fail to do so, we may become the target of a negligence claim, which can have serious consequences for both us professionally and personally. Therefore, it is critical that we understand the four elements of negligence claim: duty, breach, causation, and damages that we'll go into a little bit more detail shortly, and how they relate to our work as paramedics. By understanding these concepts, we can take proactive steps to protect ourselves and our patients and ensure that we're providing the best possible care in emergency situations. So throughout this lecture, the learning outcomes will be to define breach of duty, describe the four elements that must be present in order to prove negligence, and given a scenario in which a patient is injured while a paramedic is providing care, determine whether the four components of negligence are present, and given another scenario, demonstrate patient care behaviors that would protect the paramedic from claims of negligence. In order to prove negligence, these four elements must be present. Negligence is a concept in tort law that refers to a failure to exercise reasonable care in the performance of legal duty, resulting in harm to another party. In the context of the paramedic, these four elements can be applied as follows. So the first one is duty to act. Paramedics have a duty to provide emergency medical care to those in need with reasonable skill and care. So I'll say that again, with reasonable skill and care. Next is having a breach of duty. This refers to a failure to meet the standard of care required in duty to act. For example, if a paramedic fails to correctly diagnose a condition or recognize a condition or administer the right treatment, then there has been a breach of that duty. Next is cause and effect. So the breach of duty must have cause and effect or harm. For example, if the paramedic's mistake resulted in further harm to the patient, then there is a cause and effect relationship. Lastly, the fourth point is damage. So damage has occurred. That harm that breach has caused must result in actual damage, such as a physical injury or a financial loss. It's also important to understand that our general duty as a human is to not behave in such a way as to endanger the well-being of others. A paramedic's duty, if I were to put it in a legal description, would be to act as would another prudent, reasonable paramedic with the same level of training in the same community and under similar circumstances. Moving on to the Good Samaritan law in Quebec. Now, we've touched on this before, but we'll go into a little bit more detail here. So in Quebec, there's a unique duty imposed on everybody to help a person in peril. This duty is established by the Quebec Charter of Rights and Freedoms from 1975 and the Civil Code of Quebec. Now, the Quebec Charter of Rights and Freedoms contains a provision that requires individuals to render aid if it can be accomplished without serious risk to themselves or third parties. Okay, so it can't put themselves in danger. In other words, if a person is able to help someone in danger without putting themselves or others at risk, they are obligated to do so. Under the Civil Code of Quebec, every person is obligated to act as what they call a bon père de famille. This term is broadly defined as a reasonably prudent person. Failure to act in this manner can be considered fault and may result in legal wrongdoing. So again, in summary, in Quebec, everyone has a duty to help a person in peril as established by the Quebec Charter of Rights and Freedoms and the Civil Code of Quebec. And this duty requires individuals to render aid if it can be accomplished without serious risk and requires individuals to act as a reasonably prudent person. So un bon père de famille. Failure to do so may result in legal wrongdoing. A breach of duty by a paramedic occurs when they fail to perform within the standard of care. The standard of care is defined as the actions that a reasonable paramedic in the same or similar situation would have taken. In simple terms, a paramedic can breach their duty in two ways. The first one being a commission error. Okay, so commission error. This occurs when a paramedic does something that they had a duty, not a duty to do. For example, if a paramedic administers a treatment that is not indicated for a particular medical condition, they have committed a commission error. Okay, so they have actually done something wrong. Now, the other way a paramedic can breach their duty is an omission error. So this occurs when a paramedic fails to do something that they had an absolute duty to do. For example, if a paramedic fails to diagnose a condition that a reasonable paramedic would have diagnosed, they have committed an omission error. Okay, so omitting to provide a life-saving treatment would be an omission error. A commission error would be something like giving the wrong medication and then causing some form of damage to the patient. So again, a breach of duty by a paramedic occurs when they fail to perform within the standard of care, which is defined as what a reasonable paramedic in the same or similar situation would have done. Breaches can occur through commission errors, such as doing something that they have a duty not to do, so they should not provide or give a patient the wrong medication, or omission errors, such as failing to do something they had an absolute duty to do. So let's look at a little scenario here. Context. The law states that paramedics have a duty to come to a complete stop at a red traffic signal, even while operating with lights and sirens. So it's your first week on the job and you're responding to a cardiac arrest at 3 a.m. There's no other vehicles on the road as it's the middle of the night. You're approaching an intersection and can clearly see that there are no other vehicles. You decide to not stop and go right through the red light. Have you just breached your duty? Well, again, in quick and easy answer would be technically yes. Paramedics have a duty to come to a complete stop at a traffic light, even while operating with lights and sirens. This is established by the law and is a crucial aspect of our duty as paramedics. Of course, when we consider the scenario of a paramedic responding to a cardiac arrest at 3 a.m., the paramedic is the only vehicle on the road and they approach the vehicle at an intersection with a red light. Despite seeing this red light, we decide to go right through. Now, while we have a duty to stop in this scenario, it's important to know that it's a specific situation that is essentially tolerated because we also have a duty to respond to a medical and traumatic emergency, a health emergency. And of course, we had to weigh here the two duties to act. Of course, we have to be careful here because the situation would be very different if you went through a red light and ended up hitting somebody with the ambulance, potentially a pedestrian crossing the road at 3 a.m. You didn't see them, it was poorly lit, and you ended up causing either severe injuries or even death. You could be found at least guilty of breaching your duty to drive and follow the traffic laws. As paramedics, it's also important to understand the concept of cause and effect when it comes to potential liability for damage. When you have a breach of duty and your breach directly causes damage, then you can be considered a cause of the damage. However, the law generally requires you to also be the proximate or most direct cause of the damage. This means that if there are unforeseeable, superseding, or intervening factors, you may not be completely liable or negligent. Okay, so if we go back to our scenario before, poorly lit, you were still driving within the speed limit, you came to a complete stop before traversing the intersection. Okay, you did everything that a prudent paramedic would do in the same city, same circumstances, same level of training. Okay, these are things that you have to kind of keep in mind. But for example, another one, if you breach your duty by not following the standard of care, but the damage that occurs is caused by another factor, such as another person's actions, for example, you may not be considered the most direct cause of the damage. That doesn't mean you're off the hook. You just might not be the most direct cause of the damage, or what we call the proximate cause. So proximate cause is a legal term that refers to the most direct cause of an injury or damage. It's defined as that which is in a natural and continuous sequence, unbroken by any intervening cause, produces injury, and without which the result would not have occurred. Okay, so that is the legal definition. So as paramedics, it's important to understand that the concept of proximate cause when it comes to determining liability for damage. This is why it's essential to document a patient's status, including their neurological status, before doing anything that could potentially cause injury. So for example, consider the scenario of dropping someone who is immobilized after a motor vehicle collision causing injury. The question to consider is, did your actions cause the injury, or was it already present? Now, by documenting the patient's status before taking any action, you have a clear understanding of the situation and can determine if your actions were the most direct cause of the injury. Again, going on the same example, this is why when you learn about immobilization, it's important to do a whole detailed neuromuscular status, neurovascular exam before and after immobilization, because then you'll be able to see if the patient had the specific signs and symptoms before and after, or simply after. So is it potentially while moving the patient an injury occurred, or was the injury already there? And we'll only know this if we are able to do a proper assessment before and after any intervention, as well as documentation. Foreseeability is a crucial concept in the world of paramedicine as well. It implies that the injury or harm could have been it implies that the injury or harm could have been predicted and therefore could have been avoided if the proper precautions were taken. So for example, given an incorrect drug dosage can have serious consequences for a patient, and if the injury or harm was foreseeable, it could have been prevented with proper precautions. For example, giving some sort of opiate for pain management, well, you know that if you overdose a patient on an opiate, well, then they're going to stop breathing. Okay, so these are things or harms or injuries that are easily predictable. This is why it's essential for paramedics to have a thorough understanding of the drugs that they're administering and to double and triple check their dosages before administering medications. By understanding the concept of foreseeability and taking the necessary precautions, paramedics can prevent potential harm to their patients. Let's go through another scenario. So the context, you have a duty to check every medication before you administer it. The scenario is, on this given day, you accidentally forget to check the expiry date and administer a medication that is 6 months expired. The patient ends up having a violent reaction and is hospitalized for a month. While you believe that you are at fault, it is discovered that the drug manufacturer mislabeled the vial and it contained a completely different medication. So again, this is a completely fictitious scenario just to make you understand the concept of causation chain. So were you at fault? Yes, but the courts will likely find the manufacturer as the most direct cause of the patient's injury, thus relieving you of full responsibility. And this is what we call a causation chain. It's important to understand this concept because a duty exists when a paramedic is providing care to a patient, and if that duty is not met, the paramedic can become part of the potentially long chain of causation. For example, let's say someone else's negligent act causes harm to the patient, and you as the paramedic take over care. If you also act negligently, it can worsen the patient's harm. This is why it's crucial for paramedics to always provide patient care that meets the standard of care and complies with their duty to provide that care. The portion of the damage that you contribute to can be actionable as well. So this highlights the importance of always being mindful of your actions and decisions as paramedics and avoiding negligence. I've already told this story, but I'll repeat it again. I had taken over care from another crew that were in offload delay, so waiting in the hallway of the ER. Waiting in the hallway of the ER. They had spent several hours there with their patient on their stretcher. When my shift started, I met them at the hospital to take over care so that they can finish their shift and go home. They explained to me that the patient was just essentially taking a nap and she had been sleeping on the stretcher. At this point, it most likely had been quite a few hours that she was sleeping there. My partner and I noticed right away that she didn't seem like she was sleeping. She seemed more unconscious. She had snoring respirations, and we immediately did a head tilt chin lift, and that liberated, or that changed, I guess, it corrected the snoring respirations. We put on a SAT probe and started taking a full set of vitals. Lo and behold, her SATs are extremely low. So obviously she had, some sort of airway occlusion at that point, obviously just from her tongue. I mean, it wasn't anything bigger than that. But essentially, she was most likely hypoxic for quite some time. Obviously, she wasn't able to be woken up. She was completely unconscious. We ended up taking a blood sugar. This is where it got a little bit more complex, but essentially, her blood sugar was actually high, not low. We still proceeded, based off of the history that we had gotten from the crew, that she was found running through traffic, acting bizarre. She was somebody who lived on the street, that was known as a type 1 diabetic, and it was poorly controlled. So we decided to at least go forward and at least try to see if administering dextrose intravenously would actually have any positive outcome. And sure enough, as soon as we started giving dextrose, she woke up. Luckily, we did a full neuro exam. She was fully intact. She was alert oriented. Didn't recall any of the events, but essentially she was hypoglycemic for her. Okay. That's why, again, when we say patients don't necessarily read the textbook, she was technically in the high range and not the low range. But for her, that blood sugar, she's constantly extremely, extremely high because it's poorly controlled. So she was in a state of hypoglycemia for her body. But you can see here that if this patient, would have spent more hours unconscious, killing brain cells from low blood sugar and hypoxia, it could have been extremely, extremely bad. And if harm would have occurred, then there would have been a claim for negligence. And even though this was a transfer of care, we would have been part of that causation chain. So that's why, let it be a lesson. Always do your own assessments on your patients, whether that's picking up a patient from the hospital and transferring them, even if they're stable, or you're told that they're stable. Do your full assessment. Same thing with getting a patient from another crew. Do your full assessment. As soon as a patient becomes your responsibility, it is your responsibility. So start at square one, do a full assessment so that you make sure that you don't miss anything. So the final element of negligence is damages. When a duty is breached and it directly causes harm, the resulting damages can be physical, financial, or emotional in nature. And these damages can come in the form of medical expenses, lost wages, physical damage to property, manifested emotional distress, loss of enjoyment of life, loss of household services, loss of future earning capacity, and so on and so forth. It's important for you to understand that the harm caused by a breach of duty can have a lasting impact on individuals and families, and it's a key component of understanding negligence in the context of paramedic practice. Now, abandonment is a serious issue in the medical field, particularly for paramedics, and involves the termination of care without the patient's informed consent, and implies that the patient had a continuing need for medical treatment. This type of negligence can result in injury, illness, or even death. It's essential to understand that as a paramedic, you may not leave a patient in need of medical treatment until another competent healthcare professional with an equal or higher level of training, so I'll say that again, equal or higher level of training, has taken responsibility for the patient care. For example, dropping off a patient at the hospital and the patient is left with an RN and or physician. This is to ensure that the patient continues to receive the necessary medical attention they need to recover. Of course, there can be some exceptions to the rule, and I'll give you an example shortly. So it's imperative to follow local protocols, policies and procedures, and make sure you transfer the patient's care to appropriate medical personnel before leaving any scene or any hospital or any facility for that matter. This will protect both the patient and you from a legal or ethical ramification of abandonment. So let me give you 3 examples. Example 1, when a critically ill or injured patient patients are left unattended in a busy emergency department and die before any emergency department or ED personnel can take over their care, it's a clear case of abandonment. It's important to transfer care to a competent healthcare professional with equal or higher level of training and to provide a full report to the nurse or the doctor or whoever is receiving the patient or transferring the care of the patient. Of course, it's important to also leave a copy of the patient's information, so your rapport d'intervention préhospitalière, so your patient care report, all that should be left with the patient. Another example is non-transport patients. Okay, this is it's going to become more and more relevant in the future years when we're going to start essentially treating people and releasing them. So meaning that we treat and release and leave them at home. You have to be careful, especially for patients, for example, who are hypoglycemic. Okay, you can go there. Imagine going to a patient's home. They're non-diabetic. This happens once a month. All of a sudden, they are unconscious, hypoglycemic. You go and you treat the hypoglycemia. They wake up. You give them something to eat. And they don't want to be transported to the hospital because they say that happens to them all the time. They'll be fine. Okay? You cannot leave this patient without proper care. And actually, this was an interview question. This exact thing was an interview question for Agence Santé, where it becomes an ethical-legal issue where the patient's refusing care. Okay, but it's really important to understand that you have to convince them to try to go to the hospital and or not leave them alone. Okay, that family member, a neighbor, somebody to watch them because they are at risk of going back into hypoglycemia and losing consciousness, and they cannot be left alone. Okay, so you need to do everything within your power to make sure that they're okay before you leave if they absolutely do not want to be transported. And again, the concept of autonomy, we can't force anyone to do anything. So we'll make sure that their blood sugars have normalized. We've given them some complex carbohydrates, something that they can eat after, and you take your time. You get somebody to come and watch over them as well, and then potentially they can sign a refusal. Okay, so that's very important because if you were to leave and something happened, that could be considered abandonment. The next one is an ALS transfer. Okay, so an ACP transferring a patient down to a PCP crew. Okay, for minor injuries or something that's an easily managed condition that's within the scope of practice of the primary care provider. Okay, so that's okay. That's one of those exceptions, as long as it's within the scope of practice of the primary care provider. If an ACP was to transfer a patient to a PCP crew, but that patient required a higher level of care, that could be considered abandonment as well, even though if the patient is not technically alone. I remember working in the emergency department. Sometimes we'd get about 10 patients that we'd have to care for. And then one of my patients would get a bed or have to be sent to CT scan or MRI or whatever. And I would be stuck bringing that patient to that room or that different floor or that special test. Essentially, what I was doing there is abandoning patients. And it was a very, very, for lack of better words, sketchy position to be in. Luckily, nothing happened. But knowing what I know now, I probably would have never taken on that role, knowing how much risk was involved. I'm surprised nobody died during that time because we did not have the appropriate resources to take care of those patients. Okay, so I could have definitely potentially been found negligent within that causation chain. Of course, it wouldn't have just been me. It would have been the company I worked for, the hospital that I was at, so on and so forth. But essentially, we could have all been found negligent and me being in that causation chain due to abandonment. Let's look at another scenario. So you respond to the home of a 45-year-old male with altered level of consciousness. Upon arrival to the home, you're greeted by his wife, who tells you he gets aggressive whenever his blood sugar goes low. You find the man in the living room and cautiously approach. As you get a few feet from him, he takes a swing at you. You protect yourself and try to restrain him while your partner calls the police. He tries to punch, kick, and bite you. You are able to break loose and run out of the house with your partner. You wait safely in your ambulance with the doors locked until police arrive. The wife comes outside and pleads with you to go in and help her husband. So, could this be considered abandonment? Can the patient's wife prove negligence in this case? Can she file a lawsuit against you? Well, first of all, if this happens, first things first, don't leave the wife alone with the combative patient, okay? So let's look at the first question. Let's divide these into three questions. So the first one, technically you left the patient after you initiated contact. So it could be potentially considered abandonment. However, you were unable to render care due to his combative nature. You remained safe in the ambulance until police arrived so that you could be ready to provide care as soon as you could. So it could be argued that you should have responded with the appropriate resources and number of personnel, but the call details did not merit that. Okay, so this is almost like a gray zone and open to interpretation. But again, then we're going to go back on would a paramedic with the same level of training as you, in the same situation as you, in the same city as you, would they have done the same thing? Yes. Okay, so we don't expect all of our hypoglycemic patients to be combative and start biting and kicking us. Okay, so most likely it would be interpreted as not being abandonment. For the second question, can the patient's wife prove negligence? So again, if it could be proved that you should have known that the patient was likely to become violent, then negligence could be proved. Okay, was it foreseeable? For instance, if you knew this patient had a history of violence and you did not call for additional resources beforehand, there could be a legitimate claim of negligence. That's why sometimes too, when you're on your way to a call, some houses are actually flagged with, okay, this patient in the past has been a danger to paramedics. So in those instances, right away, police are dispatched, or if you know that you've responded to a house before and the patient was combative, you do not go in until you have the appropriate resources, and here would be the police. And can she file a lawsuit? Yeah, people can file lawsuits for many reasons. So you should always be ready to protect yourself and do everything you can do to prevent it from happening. Okay, so obviously kind of fixing a problem before it starts is something that one of my patients taught me a long time ago, and it stuck with me. So if you can make sure that you do everything in your reasonable power that you can to make sure to protect yourself, protect your patients. Okay, and we'll talk a little bit about what you can do to protect yourself, but try to fix the problem before it starts, meaning to try to nip it in the bud before the patient really wants to file a lawsuit. Okay, so, but if they do, be ready. So, protection against negligence claims. Do you think that providing good patient care and following protocols will protect you from legal action? Unfortunately, I'd love to say yes, but the answer is no. So your patient care might be flawless, but how are you driving around in the ambulance? At the ambulance base? How are you with the patient's family or other bystanders on the scene? Have you checked all of your equipment before starting your shift? Okay, so there's so many different areas where you can miss something on a specific day. You're exhausted that day, something happened, your pet died, your friend is you get in a fight with your significant other. Okay, you haven't slept because you have a newborn. Okay, you're sick that day, you're not feeling well. Okay, everybody is at risk because all it takes is one little slip up. So as paramedics, it's important to always put your best foot forward in order to avoid any potential negligence claims. So to protect yourself, here are some key points to keep in mind. So first, ensure that your ambulance and equipment are maintained in optimal condition. This includes regular checks and maintenance to ensure that everything is in working order. Again, if you work for a service that somebody else does this for you, it does not matter. Check your own equipment. You are responsible. Follow all protocols and procedures to the best of your ability. This includes following the established procedures for responding to emergencies, patient care, and any other aspect of your work. Okay. Act within your scope of practice. This means that you should only perform procedures or provide care that you are trained and authorized to do. If you're unsure, seek guidance from your superiors, somebody with more experience, your supervisors. So serve to maintain the dignity of each person you come into contact with, not just the patients. This includes treating everyone with respect and treating them in a manner that maintains their dignity and privacy. Okay, so these are other people on scene, whether a family member, friends, and so forth. And always protect and defend those around you from harm, both physical and emotional. Okay, so it's easy to always think in terms of physical, but also emotional. This includes being vigilant and aware of potential hazards and taking actions to prevent harm to yourself and others. So by following these key points, you can help to protect yourself from potential negligence claims and ensure that you're providing the best possible care to those in need. So if you'd like to check out the Chapter 4 Medical and Legal Issues in your Nancy Caroline Emergency Care in the Streets to find out more information. And these are two cases if you'd like to look them up. Case one of, and these are recent enough negligence cases. We've talked about it quickly a couple weeks ago, but there was a paramedic, Paul Zenchuk, and then Christopher Marchand and Stephen Snively. Okay, and you will be going over negligence cases specifically in labs. So please now complete the quiz that's been prepared in Google Forms and take a look at the homework that's due.